In clinical practice, we have spent decades treating pain as a pathology, a broken part to be fixed, a structure to be injected. But my 30 years in anesthesiology and interventional pain have led me to a contrarian truth. Pain is not a diagnosis. It is a signal. It is a signal that your body's internal terrain, your metabolic, structural, and nervous system health, has drifted out of balance. We are facing an assembly line model of care that relies on endless procedures without addressing the underlying biology. Today, we are going to pivot. We are going to discuss the metabolic basis of chronic pain and why the emerging science of metabolic psychiatry is the key to unlocking true relief. We often treat the brain as a black box, separated from the rest of the body's metabolic health, but biology doesn't work that way. The brain is the most metabolically demanding organ we have. When we look at chronic pain, we are often looking at brain energy failure. Research, including landmark studies from Stanford and others, shows that the medial prefrontal cortex, the MPFC, undergoes deactivation during chronic pain. In patients with chronic pain, we see gray matter loss and altered connectivity in this hub. We are literally seeing the terrain of the brain decay. Why are we seeing such profound results with ketogenic metabolic therapy in brain disorders? It comes down to a few key mechanisms. First, synaptic plasticity. Chronic pain induces hyperexcitability in the anterior cingulate cortex. Ketones act to normalize neurotransmitter ratios. Ketones act as a powerful metabolic signal to normalize neurotransmitter ratios, specifically balancing glutamate and GABA. Mechanism 2, neuroinflammation. Microglia and astrocytes are the brain's immune cells. When they are activated, they drive pain. Ketogenic therapy reduces this systemic and neuroinflammation. It calms the immune response at the cellular level. Mechanism 3, descending modulation. The MPFC sends signals to the periaqueductal gray, which is the body's natural pain brake. Improving the metabolic health of the MPFC restores this top-down inhibitory control, essentially helping your brain turn its own pain volume down. This is the exact same logic we see in nutritional psychiatry. If you feed a brain glucose-fueled instability, you get depression and pain. If you feed it a ketogenic, fat-adapted terrain, you get stability. Now, I know the contrarian viewpoint here. If it's so simple, why isn't every doctor doing it? Because it requires a mindset shift. It is much easier to write a script than to teach a patient how to fix their metabolic terrain. Standard pharmaceutical therapy for refractory pain and mental health often comes with significant side effects: weight gain, metabolic syndrome, and cognitive blunting. When we use metabolic interventions, we aren't just treating a symptom, we are optimizing the biology of the patient. This is why I have focused my work at PainMD.tv. I want to be clear about the humility required in this process. You cannot jump into a metabolic intervention without understanding your own biomarkers. We use CLIA certified labs to ensure we aren't guessing. You need to track your insulin resistance, your inflammation markers, and your body composition. This is not a quick fix. It is a structural redesign of how you relate to your environment, your nutrition, and your nervous system. Metabolic health is the bedrock of a healthy mind and a pain-free body. If you are tired of the revolving door, it is time to look at the signal. Visit PainMD.tv for more resources on the metabolic approach to neuromuscular pain management. Thank you for listening.